My name is Alicia Martinez, and I am a mental health professional working in the community college for the District of Irving, Texas. I work alongside with the school counselor, and she refers students to my private office when she finds suspicion of anxiety disorders on the student. My practice focuses on clinical psychology and awareness on mental disorders. I want to focus on anxiety disorder, and as it may be one of the most common mental disorders among the US, and it can be easily treated when it's detected. I have noticed to, that I receive an increase of patients during stressful times, as it is with the end of the semester testing or when having a high class load. Anxiety comes from Anxiety comes to be one of the ways that the body reacts to stress. Some of the symptoms may include GI problems, headaches, high blood pressure, difficulties when falling asleep, and at times, even panic attacks. Among the young patients, I opt to try relaxation techniques prior to jumping into making decisions for prescribed medication. We start with breathing techniques. Um, Patients, I do it along with the patient so that I can show them. Inhale, few seconds, exhale. The patients need to be fully aware of the sounds of their own breathing, and they can do deep breathings and exhalations a few times until they start to calm down. Another technique that I use is meditation, taking time away in the middle of the day, trying to relax your mind. It kind of resets the mind. Taking 10 minutes will help. Another component of treatment without medication will be regular exercise, as this does help the body to release endorphins, and these endorphins help to release happy chemicals within the body, and this is natural. We do weekly check ins for a month to hear if there's any improvements with the therapy. If after the few if after the first or second check-in the patient doesn't feel that this form of treatment is helping, then I do prescribe antidepressants. Uh, this are taken for a short term, but it is an immediate solution. And also, we advise psychotherapy. Um, we need to make sure that we give adequate um, length of treatment, as well as dosage and the adequate type of medicine. Um, this this is why the regular check-ins are necessary. Um, the length of the treatment also varies, and it varies because the cases are different. Every person is different, and every person carries a different load of reasons as to why they have this disorder. Uh, I want to share the story of one of the cases that I attended. The patient is 20. A patient was a 25-year-old female. She came referred, and she expressed her anxiety. She's a full-time student and a manager of a dental clinic. Patient is also married, and her husband takes care of the toddlers. It's important to mention that the husband is disabled. Um, she reported to me that she had been to ER the week prior to meeting, and she was having a panic attack. Um, she was also recommended to have a psychiatrist consult, so that's why she also ended up with me. I ended up diagnosing her with anxiety panic disorder, and the immediate treatment prescribed was mindfulness therapy. As of course, if the patient did not show any signs of improvement, then I will prescribe, or I was going to prescribe Lexapro in very low dosage, probably 5 milligrams daily. Mental health disorders are more common than what people think, and sometimes we have a lot of lack of information about the existence of these disorders. Uh, every person encounters stress at some point of their life, and it is important to continue studying mental disorders. Um, the current anxiety medication that we have has a lot of side effects, and some reports have been made that the medication also stops helping after some time. I suggest that we do need more information, more research about medications for anxiety medicine. Thank you for your time.